Suzanne, thank you so much for joining me today. I'm really excited to talk to you about hormone therapy today.
I am so excited to talk to you about anything.
You're so sweet. You're so sweet. I'm really excited because I think that this is a topic that so many women are so confused about.
Yes.
I think the story that is just lingering is that hormone therapy causes breast cancer. And that
Right.
is the only story that anybody can think about, right? And that's what we're sort of up against is sort of like let's write that story, right? Like
Yeah.
let's rewrite that story. So I think that's the issue. So let me ask you this question with regard to hormone therapy because there's a lot of talk about this. A lot of women are very confused about like when is it most effective to actually start it, right? There's all these, differing opinions and sort of this discussion. And I know we've even had this discussion of what's the ideal window for starting? Like
Yeah.
once you hit quote menopause and you're in postmenopause, is that too late? Because I think part of the problem is a lot of women don't even know that they're in
Right. Right.
premenopause,
Right.
right? That
Right.
they should even think about this. So
Right.
let's back up and think about
Yeah.
like when is the right time to start?
Great question. Well, first of all, something I've been contemplating recently is that I think I think there's a couple of cultural conversations at play here that we don't always acknowledge. But I've been thinking, and I mean, I think I really am. Look, I'm interested in the science of it for sure, but I'm so interested in the culture and the
Sure.
narratives around this. Ultimately, I think that's probably what interests me the most.
Yeah.
And one of the things I've noticed in this fear now, like, oh my God, I need to start it. Did I what it am I is this whole perfection narrative? Like you have to do it this way. And it's like, guys, take a breath, take a beat. Like, there's no one way to do anything. And yeah, there are some things that are better than others and some things that are wrong. But like, you're not going to, this whole idea of control, like, we really need to continue to examine this. So I
Mhm.
really want people who are feeling really jacked up and anxious about this to maybe like downregulate their nervous system a little bit seriously,
Yeah.
take a deep breath, and I'll maybe take a look at what is this fear about. I mean, it's a fear of like, you're going to die, you're going to do something wrong. I get that. But, like, the fear of doing something wrong, we really need to, move away from, and for me, acknowledging it is helpful.
Mhm.
Having said that, we have a big problem because in the wake of the Women's Health Initiative, we basically had no funding going toward menopause research. So, we have all these different formats that we use. We have actually some really strong, large observational data that's not the same as the gold standard we call placebo-controlled, double-blind prospective trial. It's a very specific
Mhm.
way we do things, but the money wasn't there to do it because everything got moved away. And we had such a small amount of money is budgeted in the NIH budget toward women's health at all, let alone menopause. So we don't have all the answers specifically, but we do have a lot of observational data. It looks like, look, the sooner the better you start, but certainly within the first 10 years after your last period, it seems like you will get those long-term health benefits. That's really important to know. I think in terms of when to start, I think it's a conversation you need to have with your practitioner who is hopefully a really experienced practitioner.
Mhm.
For certain, if you're having symptoms, it doesn't matter if you're having a regular period or not, but if you're having symptoms and we have excluded other reasons, there's no reason to not start hormones. That's really basic. I think for someone who's more than 10 years past menopause, who's having symptoms and doesn't have any like major contraindications, I think it's totally acceptable to start hormones. I've started hormones in women who are in their 60s.
Mhm.
There's no evidence to support that it's unsafe. There's no evidence to support it will decrease their risk of heart disease, osteoporosis, or dementia. Okay, that's really important. That's kind of broad, and I can understand why that's confusing to people.
Right. That's the issue is that there is so much confusion. A lot of women feel like, "Oh my god, I missed the window. Like,
Yeah,
it's not gonna help me. I won't do
yeah,
it." And then they get talked out of it, get
yeah,
talked into it. Like, there's
yeah,
so much confusion, right,
yeah.
about where do you start? And then also, if you throw in the breast cancer piece, right? If you
Hmm.
have a history, if you
Hmm.
have a family history, like I just went through breast cancer, there are all
Right,
these questions. Like,
right.
is it is it better to do hormones and with having had breast cancer, but Or do you need to protect yourself against osteoporosis? I mean, there's so many things that you have
Yeah.
to consider, right?
Yeah. Yeah, definitely. I will say, I think more people do have symptoms than realize. I think what happens is they don't
Mhm.
always realize that it's menopause, and then they also
Right.
start getting diagnosed with all sorts of other things, which
Mhm.
are actually menopause related, probably like mood disorders, all sorts of like random rheumatologic, autoimmune things. A lot of these things are really just exacerbations due to their hormone fluctuations. And so some of the problem is the patients don't realize it and their physicians don't. And then they end up
Right.
in polypharmacy, 5,000 meds,
Yep.
and people who already have a history of, let's say, autoimmune disorder or a GI disorder or a mood disorder, they're going to have episodic flaring. So this is like, and so, I mean, listen, for your listeners, it's important for them to know if they know their own personal history and they're seeing like, why all of a sudden is it not like under control anymore in your 42, it might be because it's perimenopause. So, that's really, I think the more we educate our patients and the community, they can advocate for themselves. So
Right.
some of this is just that kind of confusion. And again, so I would posit that most people are having symptoms, they just don't realize it's symptoms. And I think that is the time to at least start having a conversation about hormone therapy. For the women
Mhm.
who are 10 years past, it's just it's really it's individualized therapy and again risk benefit, for
Mhm.
breast cancer family history, a family history of breast cancer is not a reason that you can't use hormone therapy. If you have an increased risk of breast cancer based on your family history, that doesn't change being on hormone therapy. You still have an increased risk. So I think if you have other benefits, I think you need to understand you have other benefits. It is not a open and shut case. And I think there's a lot of fear-based decision making going on in the medical community. And again, I understand why, although I did call
Yep.
them out for being lazy because it's like, you guys at this point, it's so abundantly clear. And if it's not in your wheelhouse, just say, you know what, I just don't feel comfortable with this. Let me refer you to this person who's an expert. For those of us
Right.
who have had breast cancer, it's a more complex conversation. It's a conversation that's evolving. If you're currently being treated for your breast cancer, no, you're not. You should not be using systemic hormone therapy. You can use vaginal hormone therapy, and you should be offered that for urinary symptoms and vaginal dryness. It's absolutely safe. There's evidence to show it's safe. It's just like, again, shouldn't be a conversation, but I have this conversation all the time. People's doctors are telling they can't be on them, and it's absolutely false. And it's, urinary symptoms that are not only bothersome, but that can lead to bladder infections, kidney infections, sepsis, death in older women. This is not uncommon. I
Right.
mean, well, what are we doing? So that's a no-brainer. I think the conversation around hormone therapy in people who have had early stage breast cancer and are well past their treatment, I'm
Mhm.
one of them. I changed my mind based on the research. I'm on hormone therapy. And here's the interesting thing. I made a switch to a combination medication called Duave, which is conjugated equine estrogen, the old school Premarin that people like to
Mhm.
crap on. Turns
Right.
out it's pretty good in a lot of ways with instead of progesterone or a progestin to protect the lining of my uterus from over exposure to estrogen, there
Mhm.
is a selective estrogen receptor modulator called beta-doxyphene. What does that mean? It means it's the receptors are selective based on the tissue they're in. So in the uterus, beta-doxyphene is anti-estrogen. Great, protects the uterus. At the
Mhm.
breast, it is anti-estrogen. It protects the breast. At the brain and the bone, it is positive or neutral. Right?
Mm.
So, there's a trial called the PROMISE trial coming out of Northwestern actually.
Mhm.
And the preliminary data was reviewed at ASCO at American Society of Clinical Oncologists a couple months ago. Very promising. People with precancerous lesions, ductal
Mhm.
carcinoma in situ, were shown to have decreased progression, and it's being looked at specifically for decreased recurrence.
Mhm.
This is powerful. That's the medication that we chose for myself. That's actually the medication I choose for my patients who are at higher risk for breast cancer or who had breast cancer and are done with their treatment. And I think the data is going to bear out that it is not only a safe choice, but an excellent choice because it's protecting your bones, it's ostensibly protecting your
Right.
brain, and the rest of your and decreasing your symptoms and everything else. So I think
Right.
that's really exciting.
Yeah. No, it's really important for all of our listeners to hear is that this is not just a question about breast cancer. You have
Right.
to ask questions beyond that, and I
Yes.
think that's what you're trying to say. So, here's what I would ask. What is one question that every woman should be asking her doctor about hormone therapy? Because I think this is sort of the key of, like, what do you ask your doctor? Like, what's a checklist? Or, I mean, how do you know, like, what to ask the physician about trying to make this decision?
I mean, I think honestly, the question is, do you prescribe hormone therapy? And seriously,
Yeah,
a lot. Is this something that you are proficient at, you enjoy doing, is in your wheelhouse? Or do you have someone that a colleague that you really trust? Like, I think we always want to continue to have like an open dialogue and a partnership. And I understand why patients are frustrated and even angry. Coming in a combative way is going to make your doc, who's already under the gun and probably doesn't have enough time to keep up on literature, let alone, do your PAP and then answer your 15 questions at the PAP, that they're getting paid $80 for. Like seriously, these are human beings. We have to have compassion. So make it easy on them, make them your friend. And it's because they're more likely to be honest and be like, it's just not my thing. Or like, oh yeah, I do it all the time, and make an appointment dedicated for that. The other question is call the staff. Ask the staff, does he or she do
right,
this? Can I make a dedicated appointment to have a conversation? And then
right,
the last thing is it's not protocol driven. It's individualized.
right.
If you're 42 and you had preeclampsia, versus you're 65 and you just went into menopause 4 years ago, it's not the same conversation.
Right, right. Which I think goes to your point that it's so important, that question of asking your doctor, "Is this something that you do? Do you
Yeah.
have experience?" Because it is so nuanced and it is so personalized, you
Yeah.
need to have somebody who knows what they're doing.
Yeah.
And it's okay that not every doctor is a
Right.
specialist. It's just like not
Right.
every doctor is a specialist in eye surgery or,
Right.
bone surgery, whatever it is, or
Mhm.
oncology. It's okay to go to a specialist who understands
Yeah.
menopause
Yeah.
and hormone therapy.
Yeah.
That's
And
okay, right?
and it's really hard because we have access issues as it is just, like, getting in
For
with a
sure.
physician, so I, again, wanna really acknowledge how hard it is and that also everybody can't afford to do these things, but, the
Sure.
telehealth options, a lot of them are quite good and quite affordable.
Mhm.
I think some are better than others, but, they're definitely out there, and I think it's a good place to start if you're having a hard time finding a physician or a nurse practitioner locally, who really treats this. And I will tell you that I think that our nurse practitioner colleagues are killing it.
Mhm.
They're really
Yeah.
doing a great job.
Yeah. Yeah. So let's turn to sort of the bigger picture and some of the things that, we wanted to talk about, which is lifestyle, sort of how do we take this integrated approach, right? Because it is so much more than hormone therapy. Um, you know, And because hormones don't exist in isolation, right? What we
Right.
do on a daily basis affects our hormones, right? We
Right.
know this. So, how do you feel, factors like lifestyle and stress and sleep, how does this all interact with hormones as far as our hormones for menopause and for this conversation?
Oh my god, they are so closely linked. First of all, you can't outpatch your lifestyle. So, you know what I mean? Like referring to an estrogen patch, I mean, you know what I'm talking about, but
Yeah,
like you can do hormone therapy and if you don't do any of the rest of it,
right.
nope. That's not how it works. So, it's not like one or the other. I mean, lifestyle is not an option. Like you have to be attending to it.
Mhm.
And that's what ancient wisdom has always told us,
Yeah,
right? But
yeah.
we also understand now the interactions, like and there's so many interactions we don't understand. But if you look even like Ayurvedically, the gut is the seat of our health, right? Agni, digestive fire. They knew what they were talking about. Now everyone's like microbiome. Oh, great,
Right.
cool. They were
Yeah,
talking about that like 6,000 years ago. It's awesome that you guys caught
exactly.
up. But it is very exciting. The
Right.
microbiome is freaking fascinating. The gut is so cool. So, one of my favorite teachers and mentors is Emran Mayer, who's totally renowned gastroenterologist, and like really, I feel like brought the microbiome to the public. He's written a bunch of books, and he says that if you spread out the entire gut lining, it would be as big as a football field.
Yep.
That's how big. That is literally the way we as humans interact with our environment in every possible way. So the gut has a big impact on hormones. It's producing a large majority of our neurotransmitters, our immune system. Of course, it's how we assimilate our nutrition and turn it into absolutely everything. And it turns out that estrogen in particular is metabolized in the gut. There's something called the estroblome, which is the microbiome that is devoted to estrogen metabolism. We don't really understand all of it, but we know it
Mhm.
happens. So we know that our gut function changes in perimenopause and menopause under the influence of shifting and then declining estrogen levels. So this is another reason why like really attending to our gut health, our nutrition, and of course
Mhm.
our gut health and nutrition isn't just what we're eating. It's what we're consuming, right? I just told you it's neurotransmitters. It's your stress, it's your sleep, it's your movement.
Right.
How are you assimilating nutrition to build and maintain your muscles and your bones? These things are so, so, so important. And look, taking hormone therapy probably makes it easier to do a lot of these things, but you can do it without if you have to or you don't want to, but you have to stay on top of like your sleep hygiene, your seasonal variation and how you're eating, what's available, your consumption of media. Consumption is not just
Yeah.
food. It's the relationships, it's the energy, it's how you're dealing with what's coming at you. It's like, look, this is not the easiest time in the world to be alive. When was it ever? It's just in our face in a really different way. And how we choose to process that, how we choose to take breaks, what we choose to expose ourselves and participate in is really a matter of life and death. Social connections have been shown to be, really highly correlated to our health. And, the Surgeon General produced evidence in the last couple of years showing that isolation and loneliness are more dangerous than cigarette smoking. So these are again all things that we know. Community, spirituality, which is a way for us to connect with something larger than ourselves and decompress and release stress. Give it to God, whatever you're saying is.
Right.
Like, it really, really does have positive benefits. For women specifically, strength training, building those large muscle groups, which are metabolic drivers. So they're going to help us use our energy and build muscles, which will keep us strong, help us balance, help our bones stay strong, help us move around so we can get up out of the bed by ourselves and go to the bathroom in the middle of the night without falling over.
Right.
But also decrease our insulin resistance, decrease our visceral fat, which is inflammatory. I mean, I could go
Right.
on and on and on. So
Right.
all of this is all related to lifestyle.
Yeah. And I think that your point is so well taken that, it's so much about consumption of everything, right? I always say that our health is not based on, what we do in the doctor's office or what choice we make just today and never do it again, right? It's about everyday life. It's about everything that is coming at us 24 hours a day and
Yep.
how are we processing it? How are we digesting it? What is
Yeah.
the state of our digestion, right? And so I think that's what you're also speaking to.
Yeah.
The other thing that I've really been thinking about is, the cultural framing of menopause. Like menopause is having its moment right now. Like we both
Right.
know that, right? It's kind of all everybody's talking about it, which is wonderful,
Right.
right? But I think that, what the other healing traditions and sort of, Ayurveda, Chinese medicine, all of these other healing traditions have always looked at this time, actually all of the different transitions in a woman's, health span, as a sacred transition,
Yeah.
right? And in the United States and in Western culture, it has so long been looked at as sort of like, "Oh, you're on the downhill, like, you are over, like, that's your life is over, you're" you know? And so I feel like there's a cultural framing, sort of a rebrand almost, right, that's
Yeah.
happening
Yeah.
with menopause, right?
Yeah.
How do you How do you feel about that? Like, and what do you think about this reframe that's going on?
Well, I think anytime we're having a conversation about what we're doing and we're having some cultural introspection, that's a good thing.
Mhm.
Um, I think it's really interesting, and I think it's really important. I think to me, I mean, my perspective is that a return to kind of a little bit more of an ancient way of thinking about this. I think that's good. Let me just say that. I do think this sort of like so, okay. You know when that meme was going around where they were showing the Golden Girls at 53 and the Sex and the City girls at
Oh,
53?
yeah.
And I
Yeah.
was actually like super offended, to be honest, because I was like, why are we hating on these ladies who were like looked old? It's
Mhm.
so misogynist and so ageist. Like I fully appreciate what this meant, but it also is not embracing, in my opinion, of feminine power. It is, oh,
Mhm.
see, we're still young and sexy. That's great. You wanna be young and sexy? I'm not hating on you. Do you. Like, I
Right.
don't care. Like, I also like, dude, I was giving a talk and I don't know, it just came out of my mouth, shocking. But I was like, I'm in my sexy crone era. That's how I feel. My hair is gray. I'm doing my thing. I feel great. Like, I'm not saying like, no, don't be sexy. I'm just saying like,
Right.
why are you trying to make it like, oh, 50 is the new 20? Like, that is not advancing anything, in my opinion.
Right.
That's I think and I'm being in the weeds about it because you asked me, and
Yeah.
I think it's absurd. I think
Mhm.
it's missing the point. I think to me, and I think Ayurveda I remember a teacher of mine talking about for her menopause, she created this whole ceremony, like, she literally, like, cocooned herself and, like, went into a space separate from her family for, like, a long period of time and literally, like, reemerged, and it was so interesting and amazing, and I don't know if it was anything traditional or not, like, I don't know if she just, like, came up with this or there was but I do think that this idea of a time of, like, slowing down, withdrawing, self-care,
Right.
transformation, some of which is painful, you know,
Yeah. For
letting
sure.
go of things and then reemerging as a new version of yourself
Right.
and yet another iteration of your authentic self. To me, that's more powerful. I also
Yeah.
see there's been something very interesting for me having been through this. This return to our pre-cycling self is really interesting as like a
Mm.
return to authenticity. Think about little girls before they know that anybody's watching them. Like, right? They're not objectified yet. They're not aware of that. They're not sexualized. They're not
Right.
sexual. And they're just doing
Mhm.
themselves.
Right.
That's so beautiful. They're not doing it for
Mhm.
anybody's gaze at all. And
Yeah.
then we get into cycling, and it's a necessary part. Again, like, that's also
Right.
it's not that that's better than this, which is better than that. It's these are different versions of ourselves. It's accepting our authentic self at the time and place that we are at. And I think that the beauty for me, and I think for a lot of us, of aging and being in our authentic self and feeling our power is accepting who we are at that time. The
Mhm.
transformation for me has been spectacular.
Mhm.
I'm not easy, not easy,
Of course.
spectacular.
Yeah. Yeah, well, and I think what you're speaking to, first of all, I've never heard it put that way. So thank you for sharing that. That is profound and I really need to think about that.
Yeah, I've been thinking about it a lot.
It's amazing.
Yeah,
It's a really good frame. But the other thing that I think you're speaking to is, in that beautiful story you told about this woman reemerging is this reframe of thinking about it as a beginning
yep,
rather than an ending.
yes,
Because we have been indoctrinated to think of it as like that's the end of your reproductive years. And so
yep,
that's the end of your importance or whatever the hell you wanna call
right,
it, right?
uh-huh,
It's
yep,
actually the beginning, it's the
yep,
beginning of a new phase, right?
yeah, yeah,
That I think is really important and pretty profound, and I think that that is like a now, the next sort of iteration of the conversation we need to have.